Okay, Bismillahirrahmanirrahim. So, altogether, we will discuss about the healthcare accreditation, its concepts, processes, and quality awards in the healthcare organization. So, let's dive into tonight's topic. What is accreditation? Accreditation is a term we hear often in healthcare and other professional industries. But what does it really mean? And why is it important? So let me break it down for you in a way that's easy to understand. For step one, okay, we have the voluntary survey process. First and foremost, accreditation starts with a voluntary survey process. Now, what does voluntary mean here? It means that organizations willingly opt to undergo this process. They are not being forced. This is significant because it shows that these organizations are committed to improvement. The process involves non governmental, independent external agencies. Think about it. These agencies are completely neutral. They are not part of the government and they don't have a stake in the organization. Their job is to assess whether the healthcare organization meets the established standards. For instance, if I were running a hospital, I'd want to know that my facility is up to par with the best practices in the industry. This step is crucial because it is the first year, or I mean, the first layer of the accountability. It's about meeting the minimum benchmarks for quality and safety. Moving on to step two, the self assessment. This step is all about organizations looking in the mirror. They evaluate their own performance against set criteria. This is not just a box checking exercise, it is an opportunity to identify strengths and weaknesses. Personally, I believe that this self assessment is one of the most critical steps. Why? Because you know your organization best. You can pinpoint areas where you excel and those where you fall short before any external reviewers come in. Imagine preparing for an exam. You review your material, identify the gaps, and work on them before the final test. That's exactly what is happening here. Finally, we get to the external review. Here's where external surveyors step in. These are trained professionals who focus on performance and compliance. They don't just take your word for it, they come in, evaluate your processes, and ensure that you are actually meeting the standards you claim to meet. This step is incredibly important because it ensures objectivity. If I'm running a facility, I might think we are doing great, but an external reviewer might catch something I missed. Their perspective ensures that there is no bias and that the organization truly meets the required standards. So, why go through all of this? Well, accreditation is more than just a certificate, it is a symbol of trust and credibility. When patients or stakeholders see that the healthcare organization is accredited, they know that it has undergone rigorous checks to ensure quality and safety. It's like a seal of approval that says we meet the highest standards. In conclusion, accreditation is a step by step process that starts with a voluntary decision, moves through self reflection, and ends with external validation. It's not just about meeting standards, it's about striving for excellence and building trust. And as professionals, it is our responsibility to ensure that we are always improving and meeting those benchmarks. All right, let's talk about the benefits of accreditation as highlighted in this slide. Accreditation is not just a formality, it brings tangible advantages to healthcare organizations, providers, and patients. Let's dive into each benefit one by one. Improved care. The first and most significant benefit of accreditation is improved care. Accreditation directly enhances the quality of healthcare services provided and improves patient outcomes. Think about it. When an organization meets high standards, it's not just about ticking boxes. It is about ensuring that the right processes are in place for patient safety, treatment efficiency, and overall care quality. For instance, when protocols for hygiene, patient records, and staff training are standardized, the entire system operates more effectively. If I were a patient, knowing that an accredited hospital is treating me would give me a confidence in the care I receive. Am I right? Number two, benchmarking. Next is this the benchmarking. Accreditation allows organizations to compare themselves with other healthcare providers. This is incredibly valuable because no organization operates in isolation. Imagine being a hospital administrator. With accreditation, you can measure your performance against the best in the industry. Are your patient outcomes as good as those in top hospitals? Are your operational procedures efficient? This process of comparison not only identifies gaps, but also encourages continuous improvement. Personally, I believe that this is like a friendly competition. It pushes everyone to raise their standards. Okay, for number three, patient's confidence. Accreditation builds trust in the healthcare system and its providers. From a patient's perspective, knowing that a hospital or clinic is accredited signals reliability and safety. It's like a seal of approval that says this organization meets rigorous quality standards. For instance, if I were a patient deciding between two hospitals, one accredited and the other not, I'd likely choose the accredited one. Why? Because it assures me that the hospital has been thoroughly evaluated and is committed to providing healthcare, excellent care. Finally, okay, finally, accreditation plays a critical role in contracting. It's essential for healthcare organizations to secure contracts with insurance companies and reimbursement plans. Why is this important? In today's healthcare landscape, many patients rely on insurance to cover their treatment costs. The insurance providers are more likely to work with accredited organizations because they know these institutions meet high standards for the organization. This means greater financial stability and an expanded patient base. Without accreditation, an organization might struggle to partner with insurers, limiting its growth potential. So, in summary, the benefits of accreditation are complex. It improves care quality, enables benchmarking for continuous improvement, and builds confidence and facilitates critical contracting with insurance providers. Accreditation is not just a process, it's a commitment to excellence that impacts every level of healthcare delivery. Examples of accreditation agencies include the CIHQ, the CARF, which is the relation, the JCI, the GAHAR in Egypt, and Sibahi in Saudi Arabia. The NASCA is also an accreditation body, as well as the ISQUA, ISQA. The ISQA is considered the accreditor of accreditors, meaning it is the entity that provides accreditation to all the other accreditation bodies. So all these other accreditation bodies receive their accreditation from ISQA. All right, now moving on to the survey preparation models. The models you might use to prepare yourself for accreditation include two models. We have the just-in-time model. This is the worst, okay? This is the worst model. It's like you are inactive all year, not working or following standards. And then suddenly, a few months before accreditation, you are in a crisis situation. You start working overtime and holding a lot of meetings. So you figure out how to apply the standards, prepare policies and procedures, organize classes, prepare comments, routes, drafts, themes, and all the necessary items for the standards. The problem with this model is the no leadership commitment or lack of leadership commitment. If leadership were committed, you would not reach this stage. If there were commitment, the leader would ensure every department is following and applying the standards. Here, the goal is just to get accreditation on paper, not to make it part of the employee's behavior or the organization's performance. In the just in time model, if there's an unplanned survey visit or an announced follow up after accreditation, it is a disaster. You will need extra resources, outside help, overtime, and employees working day and night to catch up and prepare. Why not work consistently from the start, right? What about for the post survey issues? After a survey visit, when they give you comments or notes about unmet standards, once they leave, will you even address those comments? Without leadership attention or commitment, nothing will happen. The organization's culture is not built on using accreditation to improve performance. It is just about satisfying the surveyors with paperwork and making sure it is correct and organized. The right culture adapts the standard to genuinely improve performance and align the whole organization with its goals. Any question? Okay, if none, the continuous readiness model, another model, is when I have the leadership commitment and all the leaders support all the staff and work with me. Their support for all the staff to comply with the standards. They attend with them, participate in the meetings, encourage them, and do show rounds to ensure compliance. There's also routine self assessment. We evaluate ourselves even before the surveyors come to evaluate us. We conduct self assessments to identify gaps and standards and understand the improvements needed. We prepare ourselves for what? For the survey process before the surveyors come or the unannounced visit plans. We educate the staff about the questions the surveyors might ask or conduct a mock survey to see if there are any gaps or areas lacking compliance. We encourage and focus on. All right, so this slide is very important because when you understand this slide, you will know how to answer question in the exam, inshallah. When they ask you about an organization seeking accreditation, an organization wanting to achieve or obtain specific accreditation, the order is very, very important. If you mix up one step with another, you need to focus on the correct sequence and follow it. The first step is always
Leadership.
very good leadership commitment. For example, as a quality professional, I have obtained leadership commitment and have support from the management to pursue this accreditation. The next step I should take as a quality professional is to what? Conduct a review. Becomes familiar. I bring the standards and say, let's see what these standards are about. They are divided into chapters, and each chapter has specific standards focusing on specific areas. I need to analyze the standards. If questions ask you about standards, you need to know. As a quality professional, the first step after leadership commitment is to review and understand the standards. What's the next step? The next step is to form a team. Yes, because I cannot work on accreditation alone. Accreditation is a team effort. You, as a quality professional, facilitate their work. You do not apply the standards yourself alone. Everyone applies them within their respective departments while you oversee them. The next step is assigning chapter
Chapter.
owners.
Mm.
Chapter owners are typically leaders. For example, the leader for nursing, the leader for
Yes,
provision of care, the leader for quality.
mm.
This creates the team that will accompany you throughout the accreditation journey. After assigning the team, okay, we have here each team leader will form their sub team within their department. For example, the nursing leader or provision care leader. Okay, I have mentioned this one already. So you have to meet them and conduct standard education for the respective department. Next, the chapter owners conduct education based on their chapters, ensuring each department applies the required standards. Once standards are applied, we prepare the required reports, improvement projects, and everything else before the surveyors come. We communicate with the staff about how the accreditation process will proceed. We can even conduct mock surveys, show the staff how the survey will work, and train them on answering potential questions the surveyors might ask. This involves preparing them on common and specific questions surveyors might ask, ensuring their answers align with the policies. We also guide them not to over explain. Keep answers concise and to the point based on the policies and practices we are implementing. In this stage, we conduct final assessment and ensure everything is ready. This ensures everyone is aware of what's expected during the survey. Be careful of questions that involve reviewing areas and standards compliance. For example, if the question asks about review areas, know that it refers to checking compliance and adherence to standards. And this is the last stage, ensuring adherence to the applied standards. All right. Do you have any question? Um,
No, nothing.
Nothing?
No.
Everything is clear?
Clear.
Okay, clear. Okay, let's proceed. Let's look at how the accreditation process happens. It occurs over several stages. The first stage is before the surveyor come. At this stage, I'm still preparing. We try to inform our staff about the standards, the expected changes, and what to anticipate. The next stage is the survey stage. Here, we are ready for the surveyors to come. We focus on how the survey process will take place, the agendas, the alignment, and the added value we will gain when we obtain this accreditation. This includes the expectations, our forms, and the expected visit schedule. Then, after the surveyors come and leave, we move to the post survey stage. Here, you analyze the survey report. Once the surveyors leave, they send you a report, which might contain areas that are partially met or not met at all. You highlight these areas and address them by creating a corrective action
Action plan.
plan to resolve the issues. Even if you are past the accreditation, if there are highlighted areas or partially met items, this will become the first priority in any future unannounced visit. They will focus on the areas where you didn't achieve compliance, so you must address them. Even if you have already passed, you still need to work on these areas to ensure full compliance moving forward. This provides a detailed overview of what is pre-survey preparation, which is a crucial step for organizations preparing for accreditation. Let's break down the three main points. We have here the established focus groups. This is the first step to create teams dedicated to specific functions of the accreditation standards. Okay, these focus groups are responsible for addressing key areas like policies, procedures, and operational guidelines. By forming specialized groups, organization can ensure that each standard is thoroughly understood and implemented. This step promotes collaboration and accountability within the team. Next is educate staff. Staff education is vital in this process. Teams must ensure that all employees are trained on policies and procedures and know how to apply the standards effectively in their daily roles. Next is delegate recommendations. Finally, it is the essential to assign specific responsibilities to managers and set deadlines for implementing improvements. This step ensures that action are taken systematically and efficiently. By delegating tasks to the right people, the organization can address gaps in compliance and make the necessary adjustment before the survey. We also, okay, we also do a review of the readiness, the review, the points, the bridge, and the things we mentioned today in benchmarking. These are also part of the standards required, and compliance with them is necessary. HR also, or the human resource review, ensures proper training and orientation. It's essential for all employees and staff who join us in the organization to have a general orientation. This includes an overview of all the departments in the hospital and everything related to each department. After that, there's a specific orientation for the department where the employee will work. This includes the detailed aspects that they will be working on. During this step, you prepare your staff for how the survey process will proceed, where they will sit at the beginning and how it will start with an opening conference. After that, they might conduct interviews, do observations, or start with document review. Or they might request the documents to be sent to them before their arrival. So we provide education to the staff about the survey etiquette and the frequently asked questions that the surveyors might ask. We can also include this during the mock surveys. While conducting mock surveys, we pass by, ask them questions, ensure they have been trained on them beforehand, and identify the weak areas or the things they are unable to answer. For the staff, after the survey, the post-survey focus, what do we focus here? The focus after the survey is on the report they sent us and any areas that were partially met or not met. So we create a CAP or the corrective
Yeah,
action plan for those areas. Okay, this slide highlights the post-survey focus, outlining the essential steps organizations should take after completing an accreditation survey. So let's discuss each point in detail. Results analysis. The first step is to review and analyze the survey findings in detail, identifying compliance levels and gaps. This provides a clear performance overview and sets the foundation for improvements. Next is the improvement planning. After analyzing the results, the focus shifts to improvement planning by developing actionable plans, setting priorities, allocating resources, and assigning responsibilities to enhance performance. Lastly, the third step on focuses on ongoing staff training on updated standards and best practices, ensuring continuous compliance and fostering a culture of improvement. Post-survey focus involves reviewing survey findings, creating action plans for improvement, and ensuring continuous staff education. These steps are vital to sustain accreditation compliance and drive ongoing excellence in organizational performance. The JCI accreditation program enhances healthcare quality and safety internationally through a 3-year cycle of evaluation and accreditation. It focuses on continuous improvement,
Boom.
annual self assessments, pre survey data reviews, quality report revisions, and active engagement of healthcare providers. Okay, so the ORIX tool supports performance measurement, ensuring ongoing compliance and improvements. We will explore the ORIX initiative, the vital component of the JCI, the Joint Commission's accreditation process. This initiative is designed to connect performance measurement with the accreditation journey, ensuring healthcare organizations are not just meeting standards, but actively improving over time. Let's break it down step by step. Number one, the first key point of the ORIX initiative is the performance integration. What does this mean? Simply put, healthcare organizations are required to provide data on their performance, and this data becomes part of the accreditation process. For example, metrics like infection rates or patient satisfaction scores are directly tied to how the organization is evaluated. This makes the accreditation process not just policies, but also about measurable outcomes. I like to think of this as a way to bridge the theory between the theory and
Practice.
practice. Okay. It's not just about saying you are good, you need to show it with data. Next is quality improvement. The next focus of orgs is the quality improvement. Here's the exciting part. The JCI doesn't just collect data to evaluate you. They use that data to help organizations improve. ORIX supports accredited organizations by identifying areas for growth and offering tools to enhance their processes. Think about this like feedback after a test. You're not just given a grade, you are also provided with insights on how to do better next time. This step ensures the healthcare organizations are always striving for excellence. Finally, we have data analysis. The ORIX initiative collects and analyzes performance data from countless healthcare organizations. But why is this important? By pulling data, we can identify patterns, trends, and best practices across the entire industry. This benefits individual organizations by giving them benchmarks to aim for and helps the broader healthcare system improve as a whole. Imagine if your class test results were compared to schools worldwide, it would give you an idea of where you stand and where you can grow. So why the ORIX initiative such a big deal? Because it ensures that accreditation is not just a one-time event. It is an ongoing process of measurement, feedback, and improvement. By integrating performance data, supporting improvement efforts, and analyzing trends, ORIX promotes a culture of continuous quality in healthcare. Any questions so far?
No.
Okay, the topic of NCQA accreditation and its connection with HEDIS, a vital tool in assessing healthcare quality. This accreditation is a cornerstone for healthcare organizations that aim to demonstrate their commitment to high standards. Let me walk you through the details. First, let's start with HEDIS. HEDIS means the Healthcare Effectiveness Data and Information Set is a core set of measures that the NCQA or National Committee for Quality Assurance uses to evaluate healthcare organizations. What makes HEDIS so important? Well, it is mandatory. The NCQA accreditation requires healthcare organization to submit the HEDIS data. This means HEDIS is not just a guideline. It is a benchmark for evaluating performance. Now, what's special about HEDIS? It is comprehensive. It doesn't just focus on one aspect of care. It spans both health plans and like managed care organizations and individual physicians. This dual focus ensures that the evaluation covers a wide spectrum of healthcare services, from policy level management to hands on patient care. Now, let's break down the domains of measure outlined by HEDIS. These are divided into two categories: the health plan measure and the physician measures. For health plan, there are three key areas: effectiveness of care. This looks at the quality of care provided. For example, how well is a health plan managing chronic conditions or preventive care? For the access and availability of care, this measures how easily patients can access the services they need. Can they see a specialist without long wait times? Or are clinics accessible in rural areas? What about experience of care? This is about the patient's perspective, how satisfied they are with their care and interactions with the health system. Moving on to the physician measure. For physicians, we see a similar but slightly different focus: effectiveness of care. This measures the outcomes and quality of care provided by individual doctors. For instance, are treatment guidelines being followed? What about for the access availability of care? This ensures physicians are accessible to their patients. Do they have reasonable appointment availability, and are they meeting patient needs a timely manner? Okay, next, utilization. This unique metric for physician tracks how efficiently they are using the healthcare resources. Are they ordering unnecessary tests, or are they practicing evidence based care? So, why is all this important? NCQA accreditation, supported by HEDIS measure, creates a framework for healthcare organizations to evaluate and improve their services. It's not just about meeting minimum standards, it's about fostering a culture of excellence. Okay. Let me summarize the key differences between the ORIX and the HEDIS for you. ORIX is an initiative by the JCI that integrates performance measurement directly into the accreditation process for healthcare organizations. It focuses on ensuring organizations meet quality standards for accreditation. On the other hand, HEDIS, developed by the NCQA, evaluates the performance of health plan, particularly in the MCO or the managed care organization industry. It provides a set of measures focused on health plan effectiveness, access, and utilization. In short, ORIX focuses on accrediting healthcare organizations as a whole, while HEDIS is specifically tailored to assess the performance of health plans and MCO. Any question? This slide highlights the key aspects of, I don't know how to pronounce this correctly, but Det Norske Veritas, or DNV accreditation, which plays a significant role in healthcare quality and safety globally. Let's break it down. International certification. DNV provides accreditation to hospitals and healthcare organizations worldwide. This global focus ensures that organizations meet internationally recognized standards of care, promoting consistency and excellence in healthcare delivery across different regions. CMS compliance. This aligns, the DNV accreditation aligns with the CMS, stands for Centers for Medicare and Medicaid services guidelines. This compliance ensures that accredited organizations meet federal requirements, which is essential for maintaining funding and operational credibility in the United States. A key emphasis of DNB is on continuous quality improvement. This means the accreditation process is not just about meeting minimum standards. It is about fostering an ongoing culture of improvement in healthcare settings to enhance patient care and organizational efficiency. DNV accreditation ensures international certification, aligns with the CMS compliance guidelines, and promotes continuous quality improvement. It supports the hospitals and healthcare organization in delivering consistent, high quality care globally while meeting essential regulatory standards. Now let's talk about one of the most prestigious external quality awards in the US, the Malcolm Baldrige National Quality Award. This award is a benchmark for excellence and is highly sought after by organizations aiming to showcase understanding, performance, and commitment to quality. Okay. First, the Malcolm Baldrige National Quality Award is a prestigious U.S. honor recognizing organizations across industries for business excellence and outstanding performance, setting a national standard for achievement. The Malcolm Baldrige National Quality stands out for its comprehensive evaluation criteria, assessing organizations across areas like leadership, strategy, customer focus, workforce engagement, and results. This holistic approach ensures excellence in all aspects of operations. And finally, emphasizes on continuous improvement, fostering a culture of ongoing quality management and organizational excellence. It inspires adaptability, innovation, and long term success. For healthcare organizations, it aligns with key goals like patient centered care, operational efficiency, and staff engagement, serving as a roadmap for sustained growth and excellence. The Malcolm Baldrige Award criteria, a powerful framework, okay, to evaluate and promote the organizational excellence. This model is built on a pyramid structure, and each layer represents the critical element of success. Leadership at the very top of the pyramid. Why is this the foundation? Because leadership sets the vision, mission, and direction and tone for the entire organization. The criteria evaluate how senior leaders create a culture of excellence, guide the organization through change, and inspire trust and engagement. Simply, leadership is the driving force behind everything else. The second layer is the strategic planning. This evaluates how organizations set long term goals, prioritize objectives, allocate resources, and adopt strategies to changing conditions. It serves as a roadmap to success, ensuring effective direction and support for leadership efforts. The third, customer and market focus. This evaluates how well organizations understand and meet customer needs, focusing on building loyalty and improving services through feedback. The fourth is information and analysis. Okay. This one emphasizes the collection and use of accurate data for effective decision making and continuous improvement, acting as the organization's operational brain. For five, human resource development assesses how organizations empower, engage, and align their workforce with goals, fostering growth and satisfaction. Additional criteria include the process management and business results, which focuses on improving the work processes, measuring tangible outcomes. Together, these elements ensure a balanced, holistic approach to excellence. The Malcolm Baldrige framework serves as a roadmap for sustainable success, promoting synergy across all aspects of organizational performance. Let's take a closer look at the European Foundation for Quality Management, or the EFQM, which is a well-known framework for driving organizational excellence across Europe. It is designed to help organizations improve their performance and achieve sustained success. Annual Award. The EFQM Annual Award recognizes organizations for exceptional achievements in quality and performance, highlighting them as leaders in excellence. It serves as both a goal and a benchmark, symbolizing a commitment to continuous improvement and motivating organizations to excel further. Finally, next is the EFQM emphasizes an integrated approach to quality management, embedding quality into all aspects of the organization, like leadership, operations, and customer service. This shared responsibility ensures that everyone works toward the common goal, making quality a core organizational value rather than a checklist. Finally, employs the radar logic, which stands for R,
Performance also.
results, approach, deployment, assessment, and refinement, as a structured methodology for continuous improvement. It guides organizations from setting desired results to planning, implementing, assessing outcomes, and refining processes. This practical tool helps organizations stay focused, accountable, and consistently exceed their goals. The EFQM is important. The EFQM is important because it offers a clear framework for achieving organizational excellence. It helps align strategies, engage the workforce, and deliver outstanding results with quality as a central focus. Let's briefly discuss the Magnet Recognition Program, a prestigious initiative by the American Nurses Credentialing Center, or the ANCC, that sets the gold standard in nursing excellence. First, the program recognizes the healthcare organizations for outstanding nursing practices. This designation highlights facilities where nurses demonstrate the exceptional skills, innovation, and leadership in patient care. Next, it focuses on improving patient care outcomes. Magnet recognized organizations are known for providing the highest level of safety, satisfaction, and effectiveness in patient care, making them benchmarks for quality. Finally, the program promotes nursing leadership and continuous professional growth. It supports the empowerment of nurses through education, mentorship, and opportunities to advance their careers. In summary, the Magnet Recognition Program celebrates nursing excellence, prioritizes high quality patient care, and fosters professional development, and making it a hallmark of top performing healthcare organizations. All right. So this slide highlights the various standards and performance measures used in the healthcare to ensure quality and efficiency. Let me provide a quick overview of these key components. The NCQA's HEDIS. HEDIS stands for Healthcare, Effectiveness, Data, and Information Set by NCQA. Okay, NCQA, HEDIS, evaluates the health plans based on their effectiveness, access, and patient outcomes. It's widely recognized for its role in improving healthcare quality. What about for the JCI? The JCI's ORIX initiative integrates performance measurement into accreditation processes, focusing on measurable outcomes to improve healthcare organization performance. Next, the EFQM model uses the radar logic. Okay, stands for results, approach, deployment, assessment, and refinement to promote excellence and continuous improvement in organizational performance. We have also the GAHAR, the GAHAR's National Standards for Regulation, NSR, ensure compliance with quality and safety guidelines specific to healthcare in certain regions, promoting standardized care delivery. And very familiar to us is the SIBAHI, the ESR. SIBAHI's essential
Safety
safety
requirement.
requirements are designed to uphold safety standards in healthcare facilities, ensuring patient and staff protection. These standards, whether global like HEDIS and EFQM, or regional like GAHAR and SIBAHI, work together to measure performance and ensure healthcare organizations deliver safe, high quality care. Each framework brings a unique focus, fostering continuous improvement and patient centered outcomes. So that ends our discussion tonight. If you have any doubts or clarification, please, anything, anyone?
No,
Okay. If none, then we will proceed now to our cases.